So, Michael Schellenberger, the WPATH files. Now, the word expert has taken quite a beating the last few years, hasn't it? Doesn't feel like it means the same thing it used to. And these appeals to authority, to the experts, are not nearly as convincing as they used to be. This is one of the reasons why. Because institutionally, there has been a bias that has crept in, a far left, to my mind, extremist bias that has crept into everything and taken over institutions. So let's take a look. Advocates of gender affirming care say it's evidence based. But now, newly released internal files from the World Professional Association for Transgender Health, WPATH, prove that the practice of transgender medicine is neither scientific nor medical. Well, that you didn't really need to actually even be an expert to figure that out. It's also incoherent. Just right from the start. So is it that everything's a social construct, including gender? So is it that, or is it that it's set? Because apparently at the same time, in the duality of all this far left Marxist lunacy, a 5-year-old can be born in the wrong body and absolutely know for sure. So which is it? Social construct, or is it fixed? Well, I guess it just depends on the whim, on what's most convenient for the moment. But let's hear Schellenberger talking about it himself here. Let's go through this video.
A year and a half ago, a video of gender medicine experts went viral. On it, they talked about how hard it is to talk with teenagers about whether they might want to have kids one day.
It's always a good theory that you talk about fertility preservation with a 14-year-old, but I know I'm talking to a blank wall. And the same would happen for a cisgender kid, right? They'd be like, ew, kids, babies, gross. Or the usual stock answer is, I'm going to adopt. I'm just going to adopt. And then you ask them, well, what does that involve? Like, how much does it cost? Oh, I thought you just went to the orphanage and they gave you a baby. No, it's not quite like that.
That's Dr. Daniel Metzger, and he's talking about the challenge of getting what's known as informed consent from children and adolescents to undergo procedures that will result in their sterilization. Over the last several years, doctors, medical experts, and the media have all said that the best way to help adolescents in distress about their gender is to give them puberty blockers, hormones, and surgeries to align their physical sex with their gender identity. The alternative to doing so, they said, was suicide. But now a new study released last month found no scientific evidence to support the claim that drugs and surgeries prevent suicide among people with gender dysphoria. Now, I agree we should be concerned about children and adolescents experiencing distress about their biological sex. But now there's even more evidence to warrant greater caution in how we treat them. Whistleblowers have given me the internal files from the main gender medicine organization, which is known as WPATH and stands for the World Professional Association for Transgender Health. The WPATH files show surgeons, therapists, and activists discussing internally how to treat people with gender distress. What they show is that what's happening is neither good science nor good medicine. There's a discussion, for example, about the blocking of puberty of a 10-year-old girl. There's a discussion of doing genital surgery on people with schizophrenia and a dissociative identity disorder, which used to be called multiple personality disorder. At the core of medical ethics is getting this informed consent from the people receiving the medicine or from their caregivers. The WPATH files show overwhelming evidence that the professionals within WPATH know they're not getting consent from children, adolescents, and vulnerable adults or from their caregivers. They know that so-called gender-affirming care can result in lifelong complications and sterility. Their patients do not understand the implications. Many patients are unaware that they will lose sexual function, including the ability to experience orgasm. After I received these files, my colleagues and I tried to report on them as we would journalists. We quickly became overwhelmed by the size and complexity of the project. And so we decided to write a full report about the files for Environmental Progress, our nonprofit research institute, in order to put the WPATH files in the context of the best available science about gender distress. The result is a new report, WPATH Files, Pseudoscientific Surgical and Hormonal Experiment.
So what we're going to find in this is that there's no guardrails anymore, right? Everything is just what feels left-wing, what feels, I would use the word fashionable at this point. This feels like it's left. It feels progressive. We've been told that anybody who's opposed to it is one of those far-right people, one of those scary far-right people. Any person with common sense is scary and far-right. The real question is, well, it's not even a question. It's obvious that obviously American Medical Association, Endocrine Society, American Academy of Pediatrics, there's no guardrails. These can no longer be considered legitimate institutions. And let's see why.
I think the thing you have to remember about kids is that we're often explaining these sorts of things to people who haven't even had biology in high school yet. And I know I've heard others in this kind of a setting say, well,
people who haven't even had biology in high school yet.
We think adults are like really slick biologically. In fact, lots of people have very little medical understanding of stuff like that. We just, medical professionals and mental health professionals, take for granted. But I don't know still what to do for the 14-year-olds. The parents have it on their minds, but the 14-year-olds, it's like talking with diabetic complications with a 14-year-old. They don't care. They're not going to die. They're going to live forever, right? So I think when we're doing informed consent, I know that that's still a big lacuna.
So informed consent, right? I mean, from these conversations, it's clear. I mean, it obviously there's no any sensible person understands that a child cannot give informed consent to these life-changing things that are going to affect their body in ways that they can't possibly understand. How could you before you've even gone through puberty? If we're talking about puberty blockers, you haven't had a chance to live in your fully developed body yet. Obviously, informed consent is impossible, and they're talking about it themselves. These are internal discussions from WPATH. These are the people that are used to justify doing these things. These medical experiments is what I consider them to be, medical experiments on children. Here, 14 years old trans female wants gender-affirming surgery. 14 years old. Hello, my dear colleagues. I would like to know how to proceed on a 14 years old trans female who started transition since she was 4. She wants to have gender-affirming surgery, male to female, and her parents are supporting her decision. But I have never done this on such a young patient. What are your recommendations for this case? Just making it up. I mean, obviously, there's not even any kind of strict formal rules around this. They're just making it up. It's a giant social experiment. Obviously. How about this? Blockers for preteens. Height potential. I have been hearing some conflicting information about the effects of puberty blockers on total height achievement. 10-year-old patient about whether blockers will stunt his growth if he starts them now, as his doc has approved. So doctors already approved this. I understand blockers can slow the rate of growth, but for those who start them at, say, age 10, before they have hit their growth spurt and remain on them for a total of 3 to 4 years, what happens afterwards if they opt to begin testosterone rather than resume the puberty consistent with, they don't know, they're just making it up as they go along. Make changing children's lives forever in irreversible ways. I'm curious as to how medical docs approach important issues such as stature when starting blockers, especially in earlier stages of development. Are there ways to maximize growth potential for young patients? They're making it up as they go along. It's hard to understand how people could be involved in all of this and just keep going. Like, they know that they don't really know what they're doing. There's not even any real rules around it. They don't understand the processes. It's hard to imagine how an adult with a conscience could just keep going. How about this? Many young patients experiencing gender distress do not appear to understand that they may suffer serious consequences from long-term hormone use and genital surgery. Hi all, I've been thinking more about what it looks like to obtain fully informed consent. This is really the crucial issue around all of this. Informed consent. You're talking about children that you don't allow to buy cigarettes or to drink alcohol or to drive a car. I've been thinking more about what it looks like to obtain fully informed consent. I was curious to what degree, if any, other mental health providers discuss actual rates of surgical complications with clients when providing assessments for surgical care, i.e., pain or loss of sensation, need for additional surgeries, necrotic tissue, infection, hematosis, strictures, implant-related complications, etc. Geez, sounds like maybe you shouldn't even be doing it at all, right? I'm also curious if others think it is safe to assume that surgeons disclose actual complication rates versus informing clients that these complications may happen. I realize research on some of these complications may be limited for various reasons. Yeah, like since this is a fad that started like 15 minutes ago, like that, like since none of you have any idea like what the fuck you're doing, like this is just a giant experiment. How is it even possible that this could happen to any child when there are these questions around consent? How is it even possible? To me, you'd have to be a sociopath to just go along with this. We don't really know what we're doing, but we're going to keep doing it to kids. And, well, if it destroys their life, well, you know, so be it, I guess.
I just wanted to piggyback on all of the importance that comes up with the informed consent issues. I often see people who, because there's such a backlog of therapists to do some of the mental health therapeutic support, I often see people who have already engaged in some sort of, and this is again with youth, who've already engaged in some sort of medical intervention. And so one of the things I do is I just I'm sitting with the youth and their parents and I say, oh, well, so tell me more about what you know about that medical intervention. And kind of like what Dan was saying, you know, children and young adolescents, we wouldn't really expect them. It's kind of it's out of their developmental range sometimes to understand the extent.
Out of their developmental range sometimes to understand. Okay.
To which some of these medical interventions are impacting them.
We do it. We try to talk about it, but most of the kids are nowhere in any kind of a brain space to really, really, really talk about it in a serious way. That's always bothered me, but you know, we still want the kids to be happier in the moment, right?
But let's go back to what was this guy saying?
We try to talk about it, but most of the kids are nowhere in any kind of a brain space to really, really, really talk about it in a serious way. That's always bothered me, but you know, we still.
It's always bothered him. You'd think it would bother him. You would think it would bother him when they're walking kids into these irreversible, life-changing sterilizations, for example.
I appreciate that much less with a 9, 10, or 11-year-old who's starting puberty suppression. And like Ren said, if they continue on, then and I mean it's like developmentally not in their space to be able to have to think about that, and it shouldn't be, right? And so I think it is a real growing edge in our field to kind of figure out how we can approach that. I'm definitely a little stumped on it.
So they know that these children cannot possibly give informed consent. I mean, they're just saying it right here. So why are all these? Why are American Medical Association, Endocrine Society, the American Academy of Pediatrics, why are they relying on them as an authority? How does this happen? It happens when the truth doesn't matter anymore. That's how it happens. Let's go back to the chat. Sierra Rifles says, how can there not be child abuse? To my mind, it's obvious child abuse. I don't see any other option there. Right? What is the other option exactly? These people are admitting that they're making it up as they go along. Let's see. Invin says it's not informed consent if the patient is incapable of understanding the information. Exactly. Yes, you see, like normal people understand that you don't need to be an endocrinologist. You don't need to be a pediatrician. Like you don't need to be an expert to know that. Anybody can know that, right? So just we've reached a point where literally, just the layman understands the issue better, or at least has better, does actually understands the issue better than the so-called experts, and certainly has a much more moral foundation for questioning it than the experts have for defending it. I don't see how that could be any more clear. I mean, we're seeing it here. Does this even surprise anybody, by the way? Let's see, what does this one say? In a developmentally delayed 13-year-old adolescent currently on pubertal suppression. You know, this is, I always say this all the time, this is like alternate universe kind of stuff here. Like, that this is real. They're talking about a developmentally delayed 13-year-old on pubertal suppression. Okay. That may not reach the emotional and cognitive development bar set by SOC within the typical adolescent time frame, if at all. What is the ethical approach to care? What is the ethical approach to care? So you've already got a developmentally delayed 13-year-old on puberty blockers. And now you're asking, what is the ethical approach to care? You've got a 13-year-old that may not reach the emotional and cognitive developmental bar necessary. Now is the time to ask, what's the ethical approach? I mean, this is just moral blindness. I mean, I guess the person in this communication is maybe starting to go, well, hold on a second. Maybe somewhere there's a couple of neurons in the back of their head that's going, uh-oh, maybe I'm doing something evil. Let's see. So the standard would be that the adolescent demonstrates emotional and cognitive maturity required to provide informed consent as sent for the treatment. Again, wouldn't a sane person, a person with a conscience, or your average human being just wonder if a 13-year-old can give informed consent to things that they clearly don't understand. If you've never been through puberty, if you don't have an adult body, you don't know what that's like. Clearly, like, you kind of have to go through it to know what it's like, right? So right from the start, the whole thing is fucking insane.
And I think now that I follow a lot of kids into their mid-20s, I'm always like, oh, the dog isn't doing it for you, right? Yeah, they're like, no, I just found this, wonderful partner, and now we're kids and da-da-da. So I think, it doesn't surprise me.
Jesus. Dog's not doing it for you. So following them into their mid-20s, and they're saying that, well, actually, I kind of want to have kids. I found this partner, I want to have kids now. And the response is, well, the dog's not doing it for you. So that's somebody who's now in their 20s that this person sterilized as a child, going on the assumption that they could give informed consent as a child. You'd think that if this were even a remotely decent person, they would be screaming from the rooftops about this. It wouldn't need to be, leaked footage or anything like that. That they'd be on the rooftops saying, no, this is wrong. I've seen it. This is wrong. This is what's happening. I find it baffling. A lot of people say eventually people who do this to children are going to be put in prison, perhaps. It's interesting, isn't it? Anyway, that's all I got to say about that. Please like, share, and subscribe. Subscribing really helps me out. I thank you for that. I will see you next time.